When it comes to vaccine acceptance, a lot of the conversation is dominated by vaccine hesitancy, often placing the blame on individuals and communities who are not coming forward to take the vaccines.
The main barriers to non-vaccination were practical related. So in that practical domain, the top three were lack of knowledge on where to get vaccinated, vaccine unavailability, and then there were concerns about vaccine safety, efficacy, side effects. The most mentioned was distrust in governments.
One of the things that we found was the value that healthcare workers and providers found in finding key stakeholders in the community and creating collaborations in the community. So whether it's chiefs or councils, religious leaders, influential mobilizers, social mobilizers in the community, all of those places are important.
Our study population involves people living with HIV who fear stigma and discrimination. So strong relationship building approach between the counselor, principal investigators, and the participants that our team have already built with our participants over many years was very helpful. And we adopted to have long and detailed calls to explain about the study and bring about the discussions to throw light on their vaccine-seeking behaviors, challenges, and needs and recommendations.
We used human-centered design to co-design and co-disseminate targeted messages with trusted messengers to increase vaccine uptake among the assistant group. Engage the community to co-create and co-disseminate interventions that respond to their need, right? It gives them a sense of ownership, and it will also promote participation in the program.
Community-based participatory research takes the ethical approach to medical research or human research a step further by ensuring that the people who are part of this research are the ones who are designing it, are the ones who are monitoring it or controlling it.
Traditionally, we think about research as people in ivory tower generating all the knowledge, but no, this type of research really turns the focus on the people themselves, and the people are the ones generating the knowledge that will help them and then in the long run improve immunization uptake and coverage.
A point that should be taken into consideration is to get people to trust in the health system, because it's not the vaccine the problem. The problem is the conditions in which the vaccine is going to be delivered. If you don't strengthen the trust in the institutions and in the healthcare workers, how do you expect that vaccines can be properly delivered? And how do you expect to increase the vaccination coverage if you don't trust in the people that are going to provide you the vaccine?
It's important for us to be humble about what we might know and what we might not know, and equally give respect to all the stakeholders that we work with. That's extremely important, especially when you're working with marginalized communities who've been historically discriminated against. So part of being a good public health professional or a researcher is actually then figuring out mechanisms where you can open yourself to learning those sort of insights.
We actually have learned that people are very willing to actually take up vaccines. They want to be healthy. They want their children to be healthy. And it took sort of that process of engagement and community involvement.
Global leaders should invest in supporting research that generates information from communities with communities about what works best to boost their demand for vaccination and their uptake.
At Sabin, we believe the best way to reverse current immunization declines is to invest in bottom-up approaches, multidisciplinary community-based research that centers local communities as the key experts in unpacking and implementing strategies to address vaccination acceptance, demand, delivery, and decision-making. Vaccine confidence, acceptance, demand, and uptake requires it.